Hello, everybody, and welcome to another session of dental shadowing. Today we have Dr. Gresham here with us, a fellow doctor who has done a takeover on our account before, so you guys may remember her, but she's just going to give us a shadowing session today about what an MPH degree is, as well as her life as a cosmetic dentist. So, Dr. Gresham, you can take it away.
Hi, everyone. Thanks for jumping on and spending time with me this evening. Really appreciate it. And feel free, if there's any questions, send them in the chat and I will try to answer them as I go. And I'll definitely get to questions at the end. And I'll give you my email and other information at the end as well. So if you have any questions, always feel free to reach out. Okay. Like she said, my name is Dr Gresham. I am a dentist and I also have my master's in public health. I practice in Boston as a cosmetic and general dentist. I was originally born in DC and then I grew up in Maine with my grandparents and then moved to Philadelphia with my parents. So I call Philly home because that's kind of where I spent like my high school teenage years. So that's where I go home and visit my parents. For undergrad, I went to Brown and I concentrated in human biology and community health. Definitely, if you guys are thinking about dentistry, you don't have to major or concentrate in biology. That just happened to be what I actually really like to do. So I did that, but you can always major in whatever you want, just as long as you get your core curriculum and classes kind of taken care of. So don't feel like you have to go into the sciences when you're in college. After undergrad, I went to Tufts University for dental school in Boston and then kind of got stuck here, never went home after that. And when I was doing my dental degree, I did a dual degree MPH program at Tufts. If you were to start it today, you would finish them at the same time. So you'd start your MPH and your DMD program the same year. When I started, it was a very, very new program. So we actually started our sophomore year and they hadn't really worked out like the scheduling between the two schools. So I ended up finishing a year after with my MPH after I finished my dental degree. So stayed in Boston, finished my MPH and then started working and kind of just went from there. And when I'm not being a dentist, I love to run. I'm in a running crew here in Boston and spend a lot of time doing activities with them. I've run a couple marathons. I like to eat. I eat everything. Will try anything once. Same thing with travel. I will go anywhere. And then I hang out with my friends and a cat that is like nibbling my feet right now. Why did I pick dentistry? So I started thinking about dentistry in high school. I shadowed a dentist. My dad's friend was a dentist, so he would let me shadow him periodically. Like I said, I really enjoyed the sciences, so for a while I was considering medical school. But once I really spent a good summer shadowing his friend, he really let me be very, very hands-on and gave me like a lot of latitude to fill out the business aspect and kind of really told me how it was to be a dentist. He also kind of lied to his patients and told them that I was in school to be a dentist, which was not true, but I was still an undergrad, so I had a lot of years to go. But he let me assist him and kind of get really, really hands-on, and that really just kind of, changed my mind about going to medical school, and I was like set on being a dentist after that. I loved once I learned more about it, I loved the freedom to be a business owner. So compared to medical, where you go into like a group medical setting, in dentistry, you really have the option of owning your own business and really being in charge of the business side and how it runs and decision making. So I really like that aspect of the dentistry. And the work hours are pretty flexible as compared to like a traditional medical career. Like I said, I like to travel and I like to spend time with family and friends. So it really gives me a lot more freedom. Currently, I work a lot because I'm working to build up my practice, but the traditional dentist schedule is like 3 days a week and half day Fridays and no work Wednesdays. So it's a pretty sweet schedule once you're pretty established. So I also like the idea that it's pretty rare that someone's going to be seriously injured doing what we're doing, or that people are going to like die. It's rare that it's life-threatening. It does happen, but we have the tools to take care of it, and it's pretty contained. Like what those kind of fringe situations are going to be. So it's not as a terrifying career as I think medicine would be, depending on what type of medicine you would do. But I also like the idea that you can do surgeries, you can get as hands-on or as like kind of bloody and gory as you want to get with dentistry. You can do perio surgeries, implant surgery, stuff like that. Like you have the option to get pretty nitty-gritty, but you don't have to. You can kind of really pick and choose how you want to do your dentistry. And like I said, I have my MPH, so I like, you know, being able to merge my passion for public health and community health with financial and clinical career goals. So I work as a cosmetic and general dentist here in Boston, and I have my MPH, and I do utilize it day to day and how I treat patients, but I don't practice in like a traditional MPH setting. When I first graduated, I did work in a community health center, and I was pretty dead set that that's what I was going to do. But I wasn't able to do as many clinical procedures as I wanted to do, and I wasn't able to kind of grow and hone my skills that way. So I chose to move into more private practice setting. And then I do plan to go back into either community health dentistry or teaching later on. But I work in an office that focuses on preventative care, and we really try to reduce dental disease rather than just treat tooth by tooth. We really do try to treat the person as a whole, and we see each person as a part of the community that they're in. So it's more of a community-focused type of practice, which I really like. In dentistry, it's really easy to get kind of like narrow-minded and just like see a tooth, see a cavity, want to drill and fill it. But it's really nice to think of it as a whole, and you know, oral health is part of your total body health. So that's how we try to look at things at my office. And then if we're going to be doing any cosmetic work, we want, you know, there to be a good foundation, a good base for what we're doing. So we don't ever want to just kind of slap veneers or crowns on patients that still don't know how to brush their teeth or don't know, you know, how diet plays into oral health and oral care. So we really try to educate our patients. And I use my MPH in that way all the time. Also, MPH is a lot of research. You can do a lot of research. So we choose to use techniques and materials that are more biocompatible and release fluoride and other minerals to kind of just help our patients overall. So, some other products that we use are Curodont, which is a newer product that helps, like it kind of mimics proteins and scaffolding in your teeth to help remineralize the tooth. We use silver diamine fluoride, which is like a different type of fluoride that also helps remineralize the tooth. But overall, I do everything that a regular general and cosmetic dentist would do. So fillings, crowns, bridges, implants, veneers, Invisalign, root canals, pretty much a little bit of it all. But we do kind of focus on the whole body, total body care versus just tooth by tooth. The most important part of my job, I think, is interacting with patients. And I really did learn kind of how to do that with my MPH. I think, you know, getting to know a patient on like a personal level and connecting with them helps them be more trustworthy, or think of me as being more trustworthy, and let me kind of do the things that I need to do in their mouth. So I think the MPH has helped me the most in that aspect. So what is like a dental public health degree? Like, what's the purpose? Like, why would you want to do it? So the American Dental Association and the American Board of Dental Public Health defines dental public health as the science of preventing and controlling dental disease and promoting dental health through organized community efforts. So what that's really saying is just it allows us to study cavities and other oral disease at the community level versus just the tooth level, like I said before, and implement different programs and strategies to prevent that also at the community level. The biggest dental public health intervention was community water fluoridation way back in the day, but we all have fluoride in our water now because there was a town in like upstate New York that people rarely got cavities. And everyone was kind of like trying to figure out why that town in particular never got cavities, and they tested the water and it had fluoride. And all the other surrounding communities did not have fluoride. So they, you know, put fluoride in the water, and then they realized that, you know, in those surrounding communities, the cavity levels went down. So that was like the biggest community dental public health program to start. And now there's, you know, a ton of others. Some are big, like Missions of Mercy and Give Kids Smiles a Day. And right now with COVID, the ADA is working on keeping dental emergencies out of the hospital because we didn't really want to overcrowd our medical system with like people in dental pain, because we want people not going in and out with COVID. We want people seeing the dentist and actually getting the care they need versus giving them a bunch of opioids and stuff like that. So that's kind of what the ADA is working on the most now, is getting a good referral program from hospitals to dentists, and finding dentists in the area that are willing to see emergencies, that are open on weekends, that have like a late night call service, so that we're not overflowing our hospitals with dental patients when they should be focusing on COVID patients. an MPH is a master's, so that's just the master's in public health, and you can get it before, during, or after dental school. I just happened to get mine during because Tufts did have a dual degree program, but if the dental school that you go to doesn't have one, you can do it before, you can do it after. There's really no time frame of doing it. I have a friend now who's been out of dental school for like 5 or 6 years, and she's getting her MPH and going back to do a dental public health residency. So it's really something that you can incorporate at any time. Courses that Tufts focused on, Tufts is big with global health, so there's a lot of global health programs, classes. Epidemiology is you're gonna have to take wherever you are. Statistics, which I hated, but you're gonna have to take that for sure. Health literacy, which really kind of breaks down talking about health and health issues with patients on like a plain language level, is big. Cultural competence. And Tufts did a integration of dental public health course, which was, we had professors from dental school and professors from the MPH school sit with us and kind of just figure out how we could, work our path through dental public health together. I'm not sure if that's something other schools do, but it, I think, really helped that Tufts did. And we had a final project. So the final year was doing our applied service learning project. It's like, you have to do research, you have to have like a statistics component, you have to have like IRB submission. That's like a pretty big project you have to do, and I'm pretty sure most schools would do the same. They might call it something different like a capstone, but for the most part, you'd have to do that as well. And then you have the freedom to take a number of electives. So I really like global health. I had done some mission trips to Zambia and Rwanda when I was in dental school, so I focused kind of on global health, but you can kind of take it whichever route you want to do. And like I said, how has my MPH given me an advantage? I really do think the most important thing is just how I communicate with patients. I think patients feel that I see them as a whole, and versus seeing them as like a crown that is $1,000. So they think that I really do kind of see them and what their dental needs are. Outside of that, I think networking opportunities were huge. So I got to access different parts of dentistry and meet different dentists and different healthcare colleagues in Boston that I wouldn't have previously met. So just expanding my network was awesome. I got to have a comprehensive view on oral care and total body care. So I'm not like stuck treating tooth by tooth. And community-based prevention strategies that we do in public health also work in private practice, and we can use the outcomes from the program to increase revenue, to kind of get patients on board, whether that's like fluoride or a new toothpaste or whatever it might be. If that's something we can implement office-wide versus just giving it to patients sporadically, it does help increase revenue overall. So it does help your practice. There's always opportunities for mentorship, which I loved. Travel and education, I think, are huge advantages of the MPH. And then how I learned to track and data gather through the MPH has helped me do the same things in private practice. So tracking, carries risk for my patient, tracking what products work, what products didn't work, just different stuff like that in private practice has helped just to see the numbers versus kind of guessing what the rate of oral disease is in my particular practice. So I think that's how it's helped overall. So what careers can you do with a public health degree? So according to Tufts and according to the ADA, the traditional careers are government, so local and state government. So that would be working for local boards of health, or state boards of health. During COVID, whoever was kind of on like at the federal level made sure that dentists were included in phase 1 of like the vaccine rollout, when before they weren't. So if there wasn't like a dental public health professional sitting on that board, dentists would probably still be waiting to get their vaccine shot. So just different advocacy positions like that are usually where dental public health professionals go. Definitely education. So you see a lot of professors, a lot of educators who have their MPH, and people who are like working in clinical dentistry would probably be public health and private research entities. So in Boston, there's the Forsyth Institute, which works heavily with Crest to develop new products. So a lot of dentists work there. Public health dental clinics, charities, community-based practices, different government agencies. So there's if you went to a school that had like a community or like a school-based fluoride program, or had dental hygienists coming in and doing cleanings once a year. In Boston, they do that, and in Philadelphia, they do that. So it just depends on where you live, if that's something they do, but those are all like dental public health professionals who are either running those programs or developing them, and usually the ones that are putting them on. So there's a bunch of different things. Nursing homes, there's a lot of neglect with our elders, getting treatment for them. It's hard for people to get to the dental office. So dentists in the dental public health field will, develop different ways so we can make sure that we're getting our elderly members the care that they need. And sometimes you work for insurance companies, which is a double-edged sword, because they help make sure we're regulating what dentists are doing, but they're also regulating how much we get paid. So there's kind of a double-edged sword there. But there's a lot of different ways you can go. I don't think I did the traditional path because I work pretty much in private practice, but I do use what I learned a lot, and I do plan to go back and teach. So like I think I already said that I thought I wanted to work full-time in a community health center. Made the switch because I wasn't being able to do the procedures I wanted to do. I wasn't able to place implants. I wasn't able to do a lot of veneer cases just because patients didn't have the funds for that. So I wanted to work in private practice, develop all of my skills, and then take the skills and use them later on in a private public health setting, or open my own public health community health center, or teach. So that's the goal for future. Practice ownership. So I'm not going to tell anyone that they should own their own practice, but I definitely think it's beneficial. I think that's part of the reason why I wanted to go into dentistry, is because you do have that freedom. You can definitely work and be an associate for the life of your career and be perfectly happy. But I think there's so many more benefits that come with practice ownership, financially and organizationally. You can make the decisions for your practice the way you want to. You're not kind of forced to do dentistry how someone else wants to do it. So it gives you a lot more freedom. There's a bunch of different ways to get to practice ownership, though, which makes it exciting, but also a little bit tricky. One way is partnership. So if you are an associate that's working for an older doc who owns the practice, you can enter into a partnership with each other and buy a certain portion of that practice from him or her. The benefits of that are the practice is already established. You don't have to find new patients. Everything is pretty much already set up for you. You just have to then take on a little bit more of the business aspect and managerial role. But as soon as you become a partner, you're getting more money, you're making more decisions. So it's definitely a plus. The cons are, it's someone else's established practice. So people are the patients are used to the practice being run a certain way, and they might not want or the new blood coming in. So you just have to make sure it's the right situation for you, and you're picking the right person to partner with, for sure. Another type of practice ownership is acquisition. So that's when you buy someone else's practice outright and you guys are not partners, but they are fully retiring and you're fully buying the practice. So same benefits with that. You have an established patient base. You've got, all the equipment and everything pretty much already set up for you. You've got staff already. So you don't have to do much on that end. But similar cons are, the patient know old Dr. Smith and they're used to what that person did. And it might be a little bit of a switch or change for them to have a new doc coming in, but that's how a lot of dentists do it. So it's pretty common. And I think that's probably the easiest way to kind of get into practice ownership. You could do a startup, which is starting your own practice from scratch. So, finding the real estate, getting it built, getting contractors to kind of build it from the ground up. And then you're responsible for finding your own staff and equipping the whole office. So cons of that are it's a long and hard process, and expensive. But the pros are that the practice is set up exactly how you want it. You get to pick your staff, handpick them, so they're all going to kind of do things your way. You get to train them exactly how you want them to get trained. So it's kind of the best way to get exactly what you want. It's just a little bit of a harder start. You have to find your own patients. You have to build. But definitely in the long run beneficial. And then cons, other than, it's it's hard to do at the start. The first couple of years are definitely going to be rocky. And if you don't, want to have to deal with construction and dealing with contractors and stuff like that, that would be a con. The last kind of most common way to get into practice ownership would be DSO partnerships, which are getting more common now that there's like the Heartlands and the Aspens and General Dental is kind of taken over. So they will offer you like a partial partnership. You won't be more than a 50% partner, but they will, I think it's usually like 42% or 48%. So you do make more money partnering with the DSO, and you can like kind of brand the practice yourself. So it doesn't always say like General Dental, it'll say, Cars Practice, whatever you want it to say. But they will run everything from the business side. So you don't really have much say in the business. They do the same thing across all their practices, and they cover marketing and, managing all the staff and everything like that. But you do get to kind of hire and fire and do stuff like that on your local level. So that's also one way to get into practice ownership. You don't have as much autonomy, but you have a little bit more than being an associate. So a bunch of different ways to do it. Personally, acquisition is the route that I'm taking, but I've seen people and have friends who are doing it multiple different ways, and everyone's happy. So just kind of find what you want to do and go with that. So we just have some quick cases for you guys. This is, so not everything in cosmetic dentistry is like huge, like veneer cases that are, millions of dollars. It's sometimes the simplest thing can have the biggest effect on people. This was the patient. She was like 15 and she just had braces, and she had something called peg lateral. So her two teeth on either side of her central, were just shorter. And that happens a lot. It's a pretty common like birth defect. Not a huge deal. You usually just will put crowns or veneers on them when they're older, but she was having a hard time in school, and people were like making fun of her fang teeth, and she really didn't want to have them. So we just built them up with composite chairside, did composite veneers, and she was thrilled. They're a little wide just because the space left for ortho was a little bit wider, but that's not something we really had control over, and she honestly didn't care. Also her gum, because she's 15, as you get older, your gums kind of go to where we want them to go. So hers are still a little bit overgrown, especially since she just came out of braces. So that's a little uneven, but when she's like 18, 19, 20, we'll go back in and take that off and give her like traditional crowns and veneers and kind of recontour her gums. So like simple things sometimes really do make a big difference. This was definitely a bigger case. Was still one of my favorites that I've done. The older gentleman who never wanted dentures because he didn't want them to fall out of his mouth. He would rather not have teeth than to have dentures that would fall out. So he was kind of just walking around with no teeth, and I'm not really sure how he was chewing. But we convinced him to get dentures. We also placed on the top 3 implants, so that way the denture would snap onto those implants and not fall out, which was his main concern. And on the lower, we did a partial denture that connected to the teeth that he had left, as well as a couple implants to help snap that on as well. So he was thrilled. You can even tell just by his facial structure. Like before, it was all kind of sunken in, and now with his denture, everything looks more full, more youthful, and definitely had a huge impact on him. Same thing, not the biggest case ever, but patient was really, really excited, and he went home and he said he was going to have a steak for his first meal because he hadn't had one in years. So it's just things I think that's what makes me want to do dentistry every day, is really changing people's lives and, giving them the smile that they want. This is one of my favorite patients. She she grinded her teeth a lot. So we kind of figured out that she had an area problem, got her treated for that. And then we decided to do veneers on her front teeth. We also have done, so on the top we did an implant, and then since this photo was taken, we did an implant on the lower right. And then actually in a couple weeks, she's coming in for her final implant on the lower left. So we phased it. So it's not, we don't always have to do everything all at once. We work with our patients to make sure that we're working within their budget and within their time frame and giving them, the results that they want. So it's a case that's taken us a couple years to complete, but she's super happy to be done in a couple months, and so am I. We also closed a little gap on her lower with just some composite. So yeah, same thing. I love seeing her smile, and she, it's always a joy when she comes in. So those are my favorite patients, when they're excited to be there and I'm excited to see them. I would say this was maybe like a little bit of a nightmare case because it was super simple. It was just one crown on the front teeth. It was number 8. So the one to the left in this picture. So she had that crown done somewhere else in the upper picture. And she came in, she's like, it just looks one-toned and I don't like it. So those are the cases where it's a nightmare because we're going to see them all the time. And you can definitely tell that the patients are really, really picky, which is fine. It's just really hard to match a crown to a natural tooth. So we worked with her and were able to get a really good shade that, reflected the light in multiple tones. So it didn't feel monotone to her. We also recontoured her gum a little bit to make them even at the top. And it was actually a really nice result. She was really happy, but it took a long time to make her happy. But I like the challenge. And it's, again, something that I think most people wouldn't notice, but it really, really mattered to her. And she was like very conscious of it. So she was happy to have it done and happy to do it. This is just Invisalign. So this is a patient, we've been seeing her for quite a while. And she's like, always said that she didn't like her lower front tooth, how it sticks out. And she's like, never really noticed that her teeth have varying shades of grays and whites and yellows. That's never bothered her. Really, she just wanted her front tooth on the bottom to be fixed. So we gave her Invisalign and, opened up the arch. We had really good results with the Invisalign. And now that her teeth are straight, she's now like, oh, my teeth up front are yellow. I've got a gray tooth at the front. And now she's going to be doing veneers on starting with the top, and then we'll see what we're going to do on the lower. But sometimes just getting patients through that initial step of Invisalign or something small will help kind of them see the rest of their mouth for what it can be, and it'll get them kind of sparked to try new things. So that's exciting. Advice I have for people, dental school is definitely hard. I don't want to deter anyone from ever doing it. I definitely don't regret it at all, but it's hard, it's expensive. So I just would hope that everyone's as prepared as they can be for it. Know to expect long days, early mornings, long nights. It's going to be stressful. You just know that going in, but at the end, it will all pay off. It's hard to see when you're in it, but it definitely does. So don't get discouraged. I would say find good mentors as early as you can so they can help guide you along the process, and find mentors who are doing the things that you want to do. So not just a random mentor, though those are good as well, but find someone who's doing, you want to be a periodontist, find a periodontist or someone who's doing with parasurgery so you can shadow them. If you want to place implants, have a mentor who's also doing that so they can kind of give you tips and tricks so you don't have to kind of figure it out on your own. And then I would just say network. Your classmates are going to be your colleagues later on. You never know where people are going to end up practicing. You never know who's going to end up on the board of this or doing what. So just keep as many connections as you can so that you have those to call on later in life. And then have clear goals for what you want to do, because it's very easy to get off track. It's very easy to, follow what everyone else is doing just because, that's kind of the path of least resistance. But I have a couple friends who weren't really clear with where they wanted to go with dentistry after, and they're figuring it out now, but it's taken them a few years of, wasted time, wasted money. So be as clear as you can with what you want so you can kind of go right after it. And yeah, that's pretty much it. Yeah. Thank you so much. If you have any questions, ask them, or feel free, you can always send me emails or, Instagram message me.
All right, we actually have some questions in the chat for you, Doctor.
Okay.
So the first question was, what are some other nightmare types of cases you have to deal with?
It's really not even the dentistry that's the nightmare. It is the patient personalities, I think, is really the nightmare, because I've had cases that are very, very difficult where the patient's in all the time, but the person themselves is the nicest in the world. And they're like, whatever you need to do, they're very easygoing. It makes the appointment easy. But it's the patients who have not the best of personalities, I'd say, that make it really stressful and makes it a nightmare. I'd also say that because information is so accessible, people just assume that like you come to the dentist 2 times, you come 1 time, we're going to prep all 20 of your teeth, and then you come the 2nd time, and now you're going to have, Hollywood teeth. And depending on if they have decay or other things going on in their mouth, it's not that quick. So if you come in with a perfect mouth and no other issues, maybe you can have it in two visits, but usually we don't want to be putting veneers and crowns on top of cavities and, plaque and everything. So there's a few visits before to kind of get your mouth to health, and that stresses people out, I guess they'll say. So they come in with one expectation, and managing what they are expecting is probably the hardest thing. To say, no, you actually have like 5 cavities that we need to fill first, and I'm not going to put veneers on your teeth until we get those handled, is, dealing with the pushback from that is probably the biggest nightmare.
And then another question here was, why cosmetic dentistry?
Because I like doing it. I like the technique and skill that goes into it. I really like it's a challenge because each case is different. Like everyone's mouth is different. The needs that they have are going to be different. So just thinking about the cases and planning them is really fun and interesting to me. And it also just allows me to do different procedures that if I were doing only general dentistry that I wouldn't get to do. So I wouldn't, we do gum grafting, like gingivectomies, we're doing implants and stuff like that. So just anytime I can learn a new skill, I really like it. And I feel with cosmetic dentistry, without being a prosthodontist, it's given me kind of the most freedom to do that. But I never really wanted to specialize and be a prosthodontist because I like that if there's a case that's too difficult or a patient that just has a difficult personality, I can always refer them off to the prosthodontist, and it's no longer my problem.
And then another question here. I know you talked a little bit about why you wanted the MPH, but where did kind of like the fascination of going into public health start?
Started in college, I actually did I dual concentrated in human bio and community health. So I just like working with people. I like talking to people. I like figuring out like why their situation is their situation. So that's just kind of always been something I've been interested in. And when I did community health, which is pretty much, it's just what Brown called public health. It's the same thing. So when I did that in undergrad, my experience was just super positive, and the courses were kind of like, I don't want to call them like psychology courses, but it was really like getting to understand why people think the way they do, and then how can you be of service to them to get what you want at the end, but also giving those people what they need. So public health is pretty much the same thing. Like we're definitely, our goal is to get rid of dental disease and to fix oral problems and to kind of like, get rid of periodontitis and gingivitis and stuff like that. So we have a goal when we go in, but we want to read the room and see what the patients want, and be able to give the patients what they want while also getting what we want. And I think public health does that really well. It gives you the tools to kind of think that way and to the language to talk to people in that way, and not have them feel like they're being used, and making sure that it's reciprocal on both sides.
And then another question here in the chat was, what's a piece of advice you would give yourself in dental school knowing what you know now?
Don't stay up to 4 a.m. studying because it actually doesn't help. I did that a lot. I'm a little bit of a procrastinator, I'll say. So you probably know this because my emails to you always came pretty late at night. So it's still to this day, like I will like know that if it's going to take me 3 days to read the book, I'll start reading the book 3 days before. And then I'd be up all night. So as I've gotten older, I do try to not procrastinate as much. But in dental school, I was definitely like, oh, it's going to take me 2 days to study. So I would stay up for 48 hours straight, cramming it in. Don't do that. I would say, it's not good for your sleep patterns. It's not good for like health in general. And then just, dental school has it's stressful as a whole. So just adding that layer in is a little bit unnecessary. So I would try to not do that.
And then everybody's a little bit curious about Tufts. So can you mention some like pros and cons, I guess, of the dental school?
I actually had a really good experience at Tufts because I found some really good mentors. I have friends who were in the same exact class as me, and they will tell you that they hated it. So it really, I think, depends on who you connect with and if those mentors are really like looking out for you, essentially. But the pros are, it's one of the best like didactic course educations that I think you get from a dental school. I think I've definitely talked to people from other dental schools, and their coursework was not as in depth or as thorough as ours. So I really appreciate that. At the time, I was, like, why do I have to study all this? But I definitely, for sure, am happy and grateful that they were as thorough as they were. And clinically, obviously, with COVID, it's a whole different story. But when COVID is not an issue, clinically, they really try to get you in clinic as much as you can, have you seeing as many patients. Just like a number of requirements, when I compared them to people at other schools, like to graduate, we needed 14 crowns, and like, we just had a lot of different requirements to do to finish, and people at other schools had like half of what we had to do. So they were able to finish a lot faster, but I don't know that they had the same clinical skills. So I think when I graduated, no one really felt like they needed to do GPR or residency after, because unless you were going to specialize. Obviously, if you specialize, you have to do your residency, but like a general practice residency, no one really felt like they needed to do, because we had pretty good experience clinically at Tufts, where from other schools, people were really, really, really felt like they needed to do a general practice residency because their hand skills weren't there. So I think that's a benefit of Tufts. They really do a good job getting you in clinic. Downside is it takes a lot longer to graduate. Sometimes it's hard to graduate. I think we were one of the largest class sizes. I think most dental schools have like 60 or 70 people, and we had like 170. And now I think there's like 200 people per class. So there's a lot of people, so it's harder to get the requirements done for sure. You kind of have to wheel and deal to get clinic time to do it, but it's definitely possible. Another downside is it's really expensive. I think it's like, if it's not in top 3, it's definitely in the top 5 most expensive dental schools. So, yeah, I don't regret it, and it's definitely possible to pay it off, but you're going to have to be definitely more intentional about how you pay it off, and have a plan, versus if you go to school that doesn't cost as much, you can have a little bit more wiggle room. But I wouldn't change going to Tufts at all. I would definitely say there's more money than I thought there was for scholarships and different things like that. So just make sure to ask if you interview at any school, or if you get into a school, ask for like what programs are available, or do more research on, what kind of funds are available, because there definitely are some that they're not going to tell you about, but that are available. And Tufts specifically, like they give out money all the time. So, ask. And the worst thing they can say is no. It's already expensive. So, yeah.
And then actually pertaining to what you left us off with, it's not a secret that dental school is not cheap, especially a school like Tufts. So what would you say to the students who are scared to pursue dentistry because of, the debt that they could be in? Yeah.
I don't want you to say don't think about money. It's like, I have friends who like call it monopoly money, like, what's 500,000 or 300,000? It's all expensive. So I don't want you to be like that flippant. It's expensive, and it's definitely a lot of money. But when you are scaling it, or weighing it against other options, all dental school is expensive. So go wherever you get in. If you only get into expensive one, go to the expensive one. It doesn't really matter at that point. I would just say you have to have a plan. Like older dentists will be like, oh, you'll pay it off, no problem. It's all very easy. But that's not the case, because dental school was very cheap cheaper when they were in school. So you definitely have to have a plan of how you're going to pay it off. If you're going to do community health and stick with it, like if you, that's something about if you get an MPH, or even if you don't get an MPH, if you do community health, so if you work in a community health center for 10 years, they will repay all your debt. So that's an option. There are different programs. There's, I'm forgetting the acronym for it, but you can do like Army dentistry, where you go into the Army for 2 years and they'll pay 2 years of dental school, or 4 years, or however many years you want them to pay. You have to give them those years back. And I have a bunch of kids from my class who did that and are like coasting debt free right now. So it's a really, really good opportunity. There's it's a health service grant, like it's HSA or something, I forget what it is, but it's the same thing as if you were to go into the military, but you just have to go to a disadvantaged area. So they might send you to like the middle of nowhere, I don't know, Kentucky, where they don't have a lot of dentists, and you have to give them X amount of years for paying off your dental school. So I was considering doing that, but I'm like from a city. I knew I needed to live in city, so I didn't end up doing it, but it's a really good opportunity. And now looking back, that's something I wish I had considered a little bit more, because spending 3 or 4 years in the middle of nowhere to be debt-free right now would be amazing. So definitely, if you're thinking about it, really do kind of give it a fair shot. I don't think I thought about it as hard as I could have. But I would just say, if you know you want to be a dentist, it's worth it, and you will find a way to pay it off throughout whatever path you take. But don't let it dissuade you, for sure, because if you don't be a dentist, then what are you going to do? And if it's something else that is going to be equally fulfilling, then great. But if it's something that you're kind of settling for, I think I wake up every day and I genuinely do love going to work. I love, seeing patients. There are, of course, ones that are difficult to deal with, but even the difficult ones, kind of like a game, like, can I make them happy? So you find ways to get through the ones that are challenging. And for the most part, like, I don't regret it at all. And I have friends who are in finance or in other things that make them a lot more money, and they didn't have to, pay to get to where they are, but they're like miserable and they hate their lives. So I would rather have debt that I'm paying back over the next 10 years to be happy, and to know that, when I'm opening a practice and I have, that set up, I get to sell it later on. Like, you're building equity in like your career and your future. So it's definitely worth it in the long run. And I don't think my life is any less like rich because I have the debt. It's, it's fun.
Yeah, and then a little bit of a personal question. You don't have to answer, but if you can, how are you planning to pay off loans?
So I'm doing income-based repayment. So when you graduate, they'll give you 6 months of grace, and then they will set you up if you took out loans. So if you took out loans, then whatever loan servicer you went through will give you options of how you want to pay it back. So you can just get set up on a like a 10-year plan. Like, let's say the day you graduate, or whatever, the day you have to start paying your loans for 10 years, you'll pay X amount every month for 10 years. So that's a way to do it. Then you can do income-based, which is what I did. So they base how much you pay per month on like what you make on your salary. And it's like a percentage of, I think it's like 10%, or like you can tweak it to be what you want. And then every time your salary increases, the amount you pay per month increases. And I think the maximum period of time you have to pay is 15 years or 20 years. So regardless, it will be paid off by then. So that's what I'm doing. I'm doing the income-based. The 10-year one is for when you start working. It's a little unrealistic because it's like they want you to pay like $3,000 a month or something, which is like, I literally I don't, with what money? So that's not, for me, that wasn't realistic when I first started, because I was working part-time and I was finishing my MPH. And I was like, that's not gonna work out. Especially living in Boston, which is a very expensive city. It just didn't make sense. But income-based gives you a little bit of like time to ramp up. And then, now I'm paying, what they wanted me to pay, but I had 5 years of, smaller payments to get me up tier. And then ideally the goal would be to pay it off through your practice, because when you have a practice, your income is much higher, but then the tax higher. So a lot of people just, take the extra money that they're getting from their practice and use it to pay off their loan. So at least it's like not taxed at the same rate and you're paying off your loans much faster. So that's how I plan on doing it. And then there's people who like, there's, I think, a 30-year plan. So you just pay it off like a mortgage. Do whatever works for you. When you look at, though, at the end, the interest that you paid, it's a little terrifying. So that's personally why I didn't do the 30-year one. But if that's what works for you, that's what works for you. And it essentially is just like having a mortgage. So, you know.
And then another question here in the chat. I know that dental schools don't really have a lot of business or any like classes, maybe a few, but how did you actually learn the business aspect of dentistry?
So yeah, Tufts didn't, there was like one course and it was not great. So I learned it through like literally stalking and knowing my office managers and my front desk people at my offices. Anytime I was an associate, I would literally sit up front and just be like, oh, what are you doing? Why? Like, and at the beginning, I literally had no idea what they were talking about. It was like a foreign language. Now, for the most part, I wouldn't trust myself to be left alone with it 100% without someone, like without my office manager. But for the most part, I know what's going on. But they're the ones who do it day in, day out. So, and they're usually more than happy to have, because then it cuts down on errors, because when you're just in the back and doing dentistry, like, yeah, just bill for the crown. And you don't know like what insurance pays for that, or if the patient has paid, or XYZ thing. So it's helped in that aspect as well. Just, not having patients get angry because I was like, oh yeah, that's definitely covered. And then they get to the front and the front's like, no, it's not. So it helps with patient communication for sure. And then they're just happy that you're interested. So because the more I know, the less I'm going to get mad at them for errors, because I know like what's going into it. So I would sit with the office manager. I would sit with your front desk and just, if they're filing insurance claims, ask them how they're doing it. Ask them, can you help them? Can they teach you? And I've never had someone say no. And then I've read some books, but really it's easier to just do it by asking someone who you work with, for sure. And then when you open your own practice, or if you start or whatever, getting a really good office manager or someone at the front who really knows what they're doing is crucial, because you're going to be doing the dentistry. Obviously, at the end of the day, you're going to be checking over everything, but you want to be able to trust the person who's doing your finances. Actually, the dentist that I shadowed when I was in college, my dad's friend, his office manager, he didn't know anything about finances. She actually did everything for him, and she ended up that she was like stealing money from him for like years. And he had no idea, because he literally had no idea what the business side was. So you don't want to be so clueless that like someone can steal from you for 10 years and you didn't know. But do you need to know every single little detail? No, like that's what your office manager is for. But you want them to know that so that they're not taking advantage of you either.
And then a few more questions here, if that's okay.
Absolutely.
So some people want to know a little bit like about the dental school application. What would you say is the most important aspect of the application?
The application, so I would say your DAT scores, they should be good. I think everyone's going in are good. So focus on getting like a solid score there. Excuse me. And then the interview portion, I think, is kind of the most important part. I think everything else is pretty similar for everyone, but the interview is kind of where you set yourself apart. So anytime there's an essay, make sure it's like tailored towards the school. So if you're applying to Tufts, you want to like just search through the Tufts website and make sure if there's like a professor who's doing something that you're interested in. You don't necessarily have to like follow through on this 100%, but let's say there's a professor doing some type of research, you can say, oh, I see that Dr. Kugel works here and he does, biomechanics research. I think that's really awesome. And just kind of include something specific to the school so they know that you've done some research about it. And then I think that's the most important part.
And then what would you say to avoid in personal statements?
To avoid an impersonal statement, I would just try to be as like truthful and honest because they're going to ask you that in your interview. Like they're going to ask you about your personal statement. So if you've over embellished, I mean, everything in an application is a little bit of an embellishment, but if you've like over embellished, people can tell and they can see through that. So I would just try to keep it as close to honest as possible, and then make it something interesting about you. Like whoever, there's always like an interesting story about yourself. So if it's something that you're passionate about or can just get excited about, that will come through. So don't just write something bland because you think it's what they want to hear. Write something that you're actually passionate about and as close to honest as possible.
And then someone says, I know that dentistry is a long journey, but do you feel like you've backtracked your life at all, or that you're behind like socially or things like that?
No, but it just depends on what kind of student you are. Like I said, I'm a little bit of a procrastinator because I'd be like hanging out with friends or doing things that were fun. So there's definitely balance. Like I worked when I was in dental school, which I was a waitress. So there's time. You just have to like have fairly good time management skills. I wouldn't say like my time management isn't great. So I wouldn't even say you have to have great time management, but just like be aware, be cognizant of the time that you have. And you can fit in whatever you want to fit in. Like I did most of my traveling in dental school because that was like the last time I actually had a summer break. Now that I'm working, it's hard to take off a good chunk of time to go somewhere. So you can definitely, I don't feel like I'm behind socially. Like I've gone to like 30 countries. I've done everything I wanted to do. You just have to, you have to know that that's what you want to do. Like travel for me is like, I would go insane without it. Like during COVID, I haven't been able to go anywhere and I am going a little bit insane. So it's always something that's on the forefront. So like, I know I have school and I have to do well in school. That's not an option, but I also know I want to travel, and like not going is not an option. So just making time for the two. And so whatever that is for you, if it's a social life or if it's, something, a hobby or something that you do on the side, you can definitely make time for it if it's important for you. Just make sure that that's part of your plan. So when you're mapping out like what you're doing, include it in there and don't like not, because then you won't have time for it.
And then another question, what did you use to study for the DAT?
That I'm not even gonna lie, I don't quite remember, but whatever the book was, there was, I forget the name of the company, but there was just like one book. So I had a book and then I did a course. I did an online course through the same company as the book. And I don't know why I'm blanking on the name, but it's whatever the main course is. And I took the DAT twice. The first time I didn't get the score that I wanted, so I studied again and did it twice. So I think the first time I didn't do the online course, and I think having the online helped a lot because there was a lot of like flashcards and questions and memorization that I didn't do on my own.
And then another question was a little bit, I know you mentioned how you're doing a type of business into dentistry, but you're kind of like owning your own practice at the same time. What was that called again?
Acquisition?
Yeah. So can you talk a little bit about like the process of that? I guess that's what they're kind of asking.
Yeah. So it's, so I don't want to I can tell you what my process is, but it's going to be different. Any deal that happens, it's going to be different because every seller is going to be different. Like there's one practice I was looking into buying, and the seller, like he started it 30 years ago, and he literally was like, "This is my baby." So everything to him was like a huge deal because he built it from the ground up, which is awesome. Like he should think it's his baby, but like the banks and everything were like, well, it's not that special. So it was like a very tense, weird process because he had one view of the practice and I had another view of the practice. So every deal is going to be different. Now the one that I'm actually in, everyone had realistic kind of dreams for it. But in general, like let's say I'm selling my practice. I can either like list it, just like selling a house, I can like personally list it, or I can get a broker who will list it for me. And then there's a buyer who will either go through like another broker just like real estate agents. And they'll match you guys up. And then there's a whole process where you have to apply for if you need financing, you apply for financing from the bank, get a loan, and then it's a whole long kind of purchase and sale agreement process where there's a lot of negotiations back and forth, like what the seller wants, what the buyer wants. And it usually takes start to finish probably like 3 or 4 months. So it's like not a quick thing. But then once you're done, like you're the sole owner versus, if you do a partnership, like the other owner is still there. When you do an acquisition, you end up being the sole owner and the other dentist leaves. Sometimes they do stay on for like a year, kind of help transition patients, but that's something you would kind of discuss at the beginning of the deal. So each one is different. And I don't want anyone to like get too caught up on that, because you can buy a practice like any way that you want to. Like you could walk down the street and like see one and be like, I want that one. And if you offer them enough money, they'll probably sell it to you. So you could really do anything. I would say now more people are doing startups, which because there's, people want newer technology and different things. A lot of the dentists that are retiring now are like in their like 70s, 80s. So the technology is not quite there. So sometimes it's easier just to start from scratch versus going in and then having to redo everything. So just, it really depends.
And then another question was, what are the requirements to be classified as a cosmetic dentist?
So that's the thing there. So cosmetic dentistry is not like the ADA has 9 specialties. So there's prosto, perio, endo. Dental public health is actually like an actual specialty, excuse me. Oral surgery, oral pathology, oral radiology, pedo, and then general dentistry. I think that those are the 9. So cosmetic dentistry is not like a recognized specialty. So there's no real classifications. It's really just the work that you've done. And the quality of work that you're doing. So for patients, that's where it's like tricky for patients to find an actual good cosmetic dentist, because someone could say they're a cosmetic dentist and be doing really crappy work. And, that's what Instagram and, technology has made it easier for patients to find good dentists, because we see patients all the time who come in with a lot of work that's been done that's a little shoddy. But there's really actually no like clear set. I would say to be respected, it would be to join the American Academy of Cosmetic Dentists. So there's a group of dentists together, and to join that group, there are some qualifications, like there's membership fee, and they do review your work, and you have to like take certain number of CE courses with them and stuff like that. But there's no way for them to like read over your shoulder and like watch you actually do a crown prep, so they don't really know what you're doing in your practice. Most prosthodontists are like the original cosmetic dentists, because those are the ones that were doing the full mouth cases and stuff like that traditionally. But now with especially with digital dental technology like scanners and different stuff like that, you don't really have to be a prosthodontist to do cosmetic dentistry.
And then another question here, because you are a cosmetic dentist and you do veneers and things like that, what do you have to say to the people who are doing things like DIY veneers or, veneers on themselves?
Me and my friends from dental school, we have like a little group chat, and it's crazy some of the things that people are doing. I would just say don't DIY them yourself. First of all, I don't even know what chemicals are in them. So that's, I think, the scariest thing for me. It's just like your body is like, your mouth is like the start of the rest of your body, and everything that you're putting in your mouth is going to travel. Your oral mucosa will absorb things like super quick. That's why when people do drugs, they like rub it in their oral mucosa, because it absorbs like that. So if you're putting random glue or random X thing in your mouth, it's going to get absorbed and travel to the rest of your body. So I would strongly recommend that people don't do that. And then I would just say there's always ways to do things cosmetically that aren't necessarily full mouth veneers. So just find a dentist that is willing to work with you. They can phase things with you. You don't always have to do everything all at once. So there's ways to do it without it being so expensive.
And then our last question here for you today is, what is your favorite procedure to perform?
I would say right now, implants and crown preps. I like crown preps because they, it's a longer procedure, but the benefits are needed and long lasting, and it's just like fun to do. Veneers preps are a little bit more tricky, and there's definitely more finesse to a veneer prep, so sometimes it's definitely a little bit more stressful. But like crown preps, it's like in and out, and it's like very quick and easy to do. Not easy, but quick and reproducible. And then I love doing implants. It's like it's a challenge, and like the treatment planning aspect of it is exciting and a little bit stressful. It's always a little bit nerve wracking when you open it up, but I do like doing surgeries. So opening, taking a scalpel to tissue and opening it, and it's exciting.
All right. Well, Dr. Gresham, go ahead and stay behind, but thank you so much for coming today and giving us this awesome shadowing session all about cosmetic dentistry and an MPH degree. We really appreciate it.
My pleasure. Thanks for having me, guys.
All right. The post-session quiz is linked in the chat, and it'll also be in our Instagram bio for you guys, so you can go ahead and take that. This session is worth 1 hour of shadowing. All right.